If you've tried everything for your back pain, but you're still waking up sore, stiff, achy, and just overall uncomfortable, you might be missing one of the most underrated principles of spinal health, which is called spinal hygiene. So let's stop picking that scab and jump right into it. Hey there, I'm Dr. Nick. I'm a doctor of physical therapy, functional movement therapist, and most importantly, former back pain sufferer. These principles helped me to get out of back pain after my disc herniation, and I want to share all 6 of them with you. During my disc herniation, one of the things I remember is trying to get my socks on and how painful that was. Looking down at my feet, thinking there is no way that I'm going to be able to get that sock around my toes and up my calf to get to work so I didn't have to wear flip-flops to the office. And as I went from doctor to doctor, getting the MRI, getting the x-rays, going to physical therapy, seeing the chiropractor, nobody ever spoke to me about this principle. We spoke about heat and cold, core strength, massage, manipulation, the next image or injection that they were going to suggest, all the while missing this simple principle that kept me in pain for way longer than I needed to be. And it's by using these principles of movement that I was able to get myself out of pain and really out of that acute phase of irritation so that I can move forward with my core strength, with my mobility, with my neural mobility, and move on to the next steps of training and healing. But spinal hygiene is so fundamental, so important to not pick the scab. Take, for example, you get a cut on your arm. You cut that arm, it bleeds, it scabs. It takes for tissue on the skin and muscles about 2 weeks for that scab to form, for the healing to take place, for the new skin underneath to come through, and that scab to fall off so that you can be right as rain. Now, your skin and your muscles are vascular tissues. They have good blood flow and blood circulation to those tissues, and that helps that healing to occur within that 2-week period. However, your spinal discs are what we call avascular, which means that they do not get a direct blood supply. They get the leftovers after the muscles of your fingers and your toes get fed. So without a direct blood supply, the discs heal slowly, and that makes not picking the scab all the more important, because the more that we irritate it, the longer it takes to heal. Now, it is very important to understand that discs can heal. We can form new fibers and those fibers can come together. It just takes time. So this is where we need you to be a patient. So let's jump into what spinal hygiene is, what to avoid as you're moving through your daily activities, and how to best apply these principles to your daily life. Dr. Stuart McGill says that no exercise or rehabilitation program will be successful without first identifying the tissue irritants and the specific tissue triggers. And occasionally he takes his patients through what is called a virtual surgery. Many people have suggested that the reason that surgery is successful is because it makes people rest. We stop doing the irritating activities. We stop picking the scab, and that allows that tissue to heal. All tissue in your body is meant to heal. Your back is no different. And even if you've been suffering with back pain for quite some time in what we call the chronic category, you can still recover fully. And I see this day in and day out with my patients, so have hope. With many disc herniations, they come through the back aspect of the spine. If you look at the disc in kind of a clockwork fashion, forward being 12 o'clock, backwards being 6 o'clock, most of the disc herniations are going to happen between 9 and 3 in that posterior or posterior lateral, posterior sideways fashion. And that will give us, when it's on back and to the side, will give us those leg symptoms that go down the leg, into the hip, down to the knee, and down to the foot and ankle occasionally. And we know that as we're moving and healing, the higher up that the pain travels, the better your day is and the better you are recovering. So can we maximize the things that are helping us to centralize and move that pain up? And can we avoid things that send the pain down? Most people get triggered by flexing and rotating. Flexing and rotating adds torque to the lower back. And if you want to break off a rusty bolt, you get a long wrench, so you add torque. We don't want to break off a rusty bolt. We don't want to break off that disc or disc material. We want to keep that together. So we're going to decrease torque and manage our system pressures, especially when we change position. And if you guys can think about this principle of shoulders, pelvis, and knees staying in alignment when you change positions. This is step one. There are a couple really common mistakes that happen with spinal hygiene. One is that nobody knows it's a thing. Doctors don't talk about it, physical therapists don't talk about it, chiropractors don't talk about it. We talk about resolving the back pain mostly through strengthening and manipulation and passive treatments that are done to you. We never talk about how to use your body as a tool to get the jobs done throughout the day. So I think that is such an important piece of the topic. Let's just stop irritating it and then it will heal better. That makes sense to me. Does it make sense to you? So number one is the way that we sleep. Nobody talks about the way that we sleep and the position that we sleep in. Most people sleep like a pretzel because that's the way they've slept their whole life. But when we sleep with back pain, it is different. It is fundamentally different because sleep is where we do our good healing. And if you're not getting quality sleep, you're not healing well. And you know this because you wake up feeling groggy, achy, irritated, and then the next day is kind of shot. So if we can improve sleep and improve healing, you're already moving forward. The next place that most of us spend most of our time is at the office. And we want to make sure that your office ergonomics are really conducive, again, to healing. You may need to change your workspace setup. You may need to change your workflow because sitting in one position is not great for back pain. We want to make sure that we're changing positions, supporting our ergonomics, and really making sure that we are taking breaks for movement, including walking. Now, I could do an entire video on workplace ergonomics and how to set yourself up for success. If you're interested in that, go ahead and comment below with ergonomics. I just want to know how many of you are interested before I shoot that video. And the last two parts are when we change positions and when we do our daily activities, including hygiene, dressing, caring for the house, caring for the kids, all those little irritants throughout the day. Those little moments where you go, ooh, I gotta do that thing, but I know it's going to hurt. How many times do we say that in our head and start to make that little cringe face? I've got to get down and change the baby's outfit. I've got to pick up the water or the dog food. I've got to change positions and get into or out of the car. All of those little things pick the scab, irritate the back, and prolong healing. All those little moments throughout the day, sleep better, work better, heal better. So let's jump in. One of the most common ways that we can irritate that back is when we're getting into and out of bed. As we do this transfer, what many people do is they get in and they lay back and we get stiff and sore and achy, and then we finally get semi-comfortable on the bed. Now, what we're gonna do is a little bit different here, you guys. First, as we're standing, we're gonna draw in that belly button and really engage our core here. So we wanna draw in and wide. And then we want to sit back into our hips, pushing back, allowing our hips to bend, knees to follow. Then, instead of rolling back, we're going to roll to the side. As I roll to the side here, I want my legs to come up. Now I can go back onto my back here, and we're going to make that two parts. Once we're in bed, what we have to do is get ready to sleep. And you'll be able to tell if you have a pain-free or tension-free position within the first 15 seconds. So allow yourself to breathe and relax into that position. Notice if you have any tension in the spine. If you do, change positions. And you can try one of these three positions that I'm going to suggest for sleeping throughout the night. There are lots of good postures and we're going to go over them. Now, most people are side sleepers. And so what they're going to do is to lie on their side, maybe one foot comes over, one foot back. We curl up into the covers and we're trying to get to bed. But what we've done is create this amazing amount of rotation and torsion at the lower back. And you want to think about the position that you're sleeping in like a low-grade stretch, because it really is. If I hold my finger like this and bend my finger for a little bit, it's not going to hurt. I'm going to feel stretch and I'm just going to notice that there's tension in that tissue. But if I hold this for 10 minutes, an hour, 4 hours, yes, when I come back to bring that finger back, it's going to be sore. It's going to need to move a bit. That tissue has been taken to its end range for a prolonged amount of time. So again, we're going to minimize torsion. So instead, what we're going to do is we're going to add a pillow, not just between the knees here, as most people would suggest, but I want you to add it between the knees and the heels. So that's your hip, Knee and ankle are nice and in alignment in a straight line. And we can also look for nose, sternum, belly button, seam of the pants. And if we take the top line, we're looking for ears, shoulders, hips, and heels. Now you can probably see in the video that my neck is a little cocked up here. So this pillow would be a little too high for me when I really want to be somewhere down here. I have to really push into this pillow for that. It's just the one that I had available. Now you might think that, okay, I've already added a pillow to my knees, no big deal. The next thing that everybody does, especially if it's cold outside, is we core up and we grab those blankets and we just try to get cozy. Very normal. Again, we added rotation to the spine and we did not stabilize in that neutral position for our sleeping posture. So what I suggest is to take another pillow, lay it long ways across you, set your elbow up in line with your hip, and then take the end of your hand to the end of the pillow. You can hold the corner or in the center here, whatever is more comfortable to you. And as you lay like that, now we have placed ourselves in a neutral position. And as you go through the night and you're trying to get comfortable, you can lay on this side, you can take the pillows and lay on the opposite side. Not too bad there. She's getting the covers back on and off. Now, what I want you to notice is that as I move my legs from being bent to straight, my pelvis rolls forward ever so lightly. And that's because our lower back has normal curves to it. The neck and the lower back have the same curve. Would you ever sleep without a pillow? For most of us, the answer is no there. And it's because we want to support the curve of the neck, right? But we're not supporting the curve of the lower back. And you can do this quick experiment at home as you're laying down. If you lay flat, do you have pressure or tension? If you bend one knee, does your back feel better? If you bend two knees, does your back feel better than the one before? If the answer is yes, great, then you need to support that lumbar spine. And for 95% of us, the answer is going to be yes. So what we do is we take the same two pillows that we had. We're going to add them under those knees. And now we can get some good rest here. We've supported the lower back. We've supported the neck. Again, I want my ears, shoulders, hips, heels to be in line here. Same lined up principle for that spinal hygiene. And we can change those positions fairly quickly, fairly easily. Finally, if you are a stomach sleeper, we want to support the lower back again. And there are two ways to do this. Number one is to have your feet dangling off the bed there so that your ankles can just be lower or equal to the bed. If that's not possible and your feet aren't going to dangle or you just think that's weird, add a pillow underneath your shin. What this is going to do is, again, take off a little bit of pressure from that lower back. You'll notice it fairly immediately. If you need a little bit more support, you can also place a pillow underneath the pelvis and underneath the shins, and that will be your most supportive position there. So as Dr. McGill said, we can't heal fully without really identifying the true irritants and the true causes of pain. And I find that many people have a diagnosis of back pain or diagnosis of sciatica without understanding their why. Why did I get to this position? So I want to help you guys out with that. I have a free guide to a better diagnosis. It's going to tell you your why, tell you your true diagnosis. The other aspect of that is many people can have multiple diagnoses. And if you've been struggling with back pain for any amount of time, this is one of those things that can keep you irritated and keep you from healing fully because more than one thing is going on. Your practitioner wants to hang his hat on one thing, but when you have 2, 3, 4, 5 different issues going on at the same time, you need to heal those respectively. And this is where the guide to a better diagnosis is key. If you want that free document, go ahead and comment below with guide. I'll be happy to send that right over to you. Now, as we jump into workplace ergonomics, I want to address the chair. The chair is such an important piece of the puzzle because we're going to be spending most of our time here. Ideally, you want a chair where your feet hit the floor. If you'll notice, even though my back is coming all the way to the back of the backrest, as soon as I do that, my heels come off the floor. And I can try to get them, but they're just off. So this chair is just a smidge too high. And this can be really challenging to get the chair and the desk to be a good height for you. We need to start from the floor. Posture always starts at the floor. And so getting those heels to be flat is super, super important. If we're unable to get our feet to the floor or our hips all the way back in the chair, what we need to do is then add in either some lumbar support or build up the floor. So put like a book or put a small leg rest at the base of the footrest so that you can have good purchase. It is extremely hard to maintain good posture with your chest upright, good diaphragmatic breathing, ears over hips when you don't have your feet and your heels touching there. It just makes it that much more challenging, and we end up going here. Now, that may not seem like a lot, but what it does is it puts excessive pressure on that lower back, cumulative over time. And again, we're trying to take out all the little spinal irritants throughout the day so that you can really focus on your rehabilitation program. So let's get this posture and ergonomics correct. So once we've got our feet flat, we've got our hips all the way back in the chair, we've built up the floor or the chair so that we're at a good position. Next, we want the hands and the elbows to be at 90 degrees. And you'll see here how now that my chair is level, my desk doesn't actually suit me. It's a little too high for me. So I need to build up that floor so I can get to be at a good position. And you can really be creative here about what types of things will build you up. It does not have to be fancy. It doesn't have to look good. It needs to be effective. So we'll take our yoga mat here, place it right down underneath the desk. And now that I can bring my chair up just a smidge, my feet are flat, I have good purchase, I can move that around and work into better posture and better control as I'm moving through my workday. One of the other things that tends to be a spinal irritant is getting into and out of the car. And most often what we will do to get in the car is to reach, kind of do one of these, and then sit in one setting. Now, this is very similar to our bed transfers. So instead of going in one move, we want to make it two movements. And so what I want you guys to do now is to use the door, use your seat, and to sit back into that seat and chair. Remember to activate your core. Remember to sit back into your hips and control down using your arms. Then as you turn to get into the car, lift one leg and rotate your shoulder with you. So we're always keeping shoulders, pelvis, knees in alignment as we get into the car seats and go for our ride. Then we can use the same principle that we used for our ergonomic setup for our workstation with feet on the floor, hips all the way back, and if not, building those surfaces up so that you can have better purchase and better posture as you're going for your ride. I've seen so many back pain clients over the years struggling with car rides because of the bumps and the poor setup, the poor ergonomics, the poor low back support that are in cars that they've had to lay down across the back seat. And so we want to make sure that we handle this before any of that becomes a problem. Tips 4, brushing your teeth that tend to take us into just a little bit of flexion, which can very much irritate that spine and irritate the lower back. As you're brushing your teeth, we all know that we have to get into the sink, we have to wet the toothbrush, rinse our mouth out, and we have to go through that whole spitting process and spitting out the toothpaste and all of that. So this is my tip. As you're going through and going to brush your teeth, instead of using the sink as the bowl, take another bowl with you. In the hospital, we would get these terrible looking little Pepto-Bismol pink dishes so that patients can have that little bit of water to rinse and spit and that type of thing. But at the house, nobody does this. So what I want you to do the next time that you have to brush your teeth is take a little bowl with you to the bathroom. You're going to use that to spit into. Go ahead and rinse and get your toothbrush ready. Go through that teeth brushing process. Make sure to get all the sides and make sure that when you spit, instead of spitting all the way into the sink, you just use this to bring the sink to you. You can rinse that out and also scoop the water up with you to then rinse water rather than reaching with your hands to bring water to the mouth. So use that bowl almost as a cup as well, and that'll minimize that little bit of flexion that you have to do. Now, when you have to get forward and when you have to move forward, I suggest a staggered stance. And what that means is 1 foot forward, 1 foot back. You actually want 4 to 6 6 to 8 inches of space in between the feet widthwise, and then have your one heel where the toes meet on the other side here. So from there, you can push back into your hips. It's almost like a deadlift. We call this a split stance deadlift position, but it's done without weight. We're engaging that core and we're using it just to get to, maybe I have to get into something about waist high and get into that drawer. Could be in the kitchen, could be in the bathroom. And I'm just going to push back through my heels and hips to load this back side, keeping my pelvis steady, keeping my shoulders, hips, and knees in alignment so that I can do that daily task, grab whatever I need to get, and not flex that spine. It's the little things that matter here, guys. And finally, our bonus move here is how to get to and from the floor well. So let's go through that process. First, we're gonna go into a lunge position. Now, this is where you need a little bit of balance and a little bit of flexibility. You can use a chair or 2 chairs, some support from a counter, whatever is necessary to make this position, to make this movement successful for you. I always suggest putting a pillow down or some type of support down so that you don't irritate the knees because, let's be honest, we want to save those knees. We want a good amount of space here, quite a bit of space, almost a pillow length in between the heel and the toes here of the opposite leg. I suggest that your heel is off of the back foot so that you can come straight down. I'm using this back thigh to come down into that position as I create these 90-degree angles. Again, as I'm changing positions, I'm going to activate my deep core intentionally. I want to stabilize that spine, and then I'm going to bring the opposite leg back. If you're dealing with a severe disc herniation, especially, you're going to want to draw that belly button in, stay into your hips and heels. And then from here, you're gonna wanna walk your hands down your thighs as you push your hips back, coming to floor. We're gonna come to all fours here. And now we can get down to the floor. I can move around from here, whether I need to go to a roll. Again, I'm keeping shoulders, pelvis, and hips in line and moving through comfortably. So I can go to either side, left or right, and move about. But I suggest staying in those planes, bring the hips back under you, walking back with that core engaged, and then coming back to our lunge position. To stand back up from the lunge, bend your toes so that you can push through both legs. Make sure that it's not just a front leg movement or that I'm just going forward into that to pull myself up. You actually want to drive yourself up from here and then bring ourselves up to tall. So that's it for this video today. We went through a lot, and there are so many positions throughout the day that we find that can irritate our back. What is one principle that you learned today, one changing of postures or movements that will help you to move forward as you move forward with your rehabilitation program? I'd love for you to comment below. Tell me what resonated with you and what stuck out. If you guys have any questions or need any support with any of these principles or moving forward from back pain, please don't hesitate to comment below. If you would like a whole program laid out for you that's going to walk you through step A through Z back to a healthy, happy life with running, lifting weights, growing your family, taking care of the household, whatever it may be, I've got that all laid out for you in what's called the Bye Bye Back Pain program. So if you'd be interested in learning more about that, go ahead and comment below with Bye Bye Back Pain, and I'll be happy to reach out and see if that would be a good fit for you. Otherwise, thanks for subscribing. Thanks for giving it a like and comment. Thanks for sharing, and I will see you guys on the next video.